Hello, Internet. It is update time. In fact, it is way beyond update time. It's been just about a month since I've posted, but the reason I hadn't gotten on, other than just busyness of life, is that there hasn't been a lot new to say. And I'm pretty sure that I mentioned in my last video that I was going to have labs and scans and oncology meeting coming up on August 21st, and that was yesterday. So I do have news now because of that entire day down in Rochester at Mayo. I left at 6 in the morning, didn't get back until 7 in the evening. Labs, scans, waiting for results, which is always, again, you've heard the term scanxiety. It's always, stressful, anxiety producing to wait for those results to come in, which they did gradually over the course of the day. And then I had my meeting with my oncologist. I did get to meet with the main doctor who kind of manages my case now, and she has for the last year or so. We had a great time, almost an hour spent talking not only about the cancer and treatment and the science and the medicine of it all, but also I feel like she's a really good counselor. She is very concerned about me as a human being, and I appreciate that because she's and not only her, but the whole team, I've been so impressed all along. They are very, very sensitive and tuned in to the balance between quality of life and successful, effective treatment. And of course, that's different for every single person. Some people experience different kinds of side effects. Actually, everybody has different side effects from even the same treatments. So what comes across to me is that the whole team, and particularly my doctor, it just seems like they are very concerned about how I am handling the situation and how I'm tolerating treatment. And of course, I had ablation procedures as well back in July. So she was curious about my recovery from that and the after effects. And then we talked a little bit about what to do moving forward in the case that I would need treatment again. Would I want to go through the same kinds of treatment, the monoclonal antibody, which is the panitumumab, and then the capecitabine pills? You guys may remember that's what I was on before, and all the side effects that I had with skin and my fingers splitting open like the Grand Canyon. Anyway, all of that is for later, because the good news is right now I do not have to go on treatment again. And my blood work was all very good. My magnesium levels are back to normal. Magnesium really took a hit from that panitumumab, and in addition to my treatment, I was having to get magnesium drips, which could last up to 4 hours. I had to do that several times back in the late winter and springtime, between February and late April, if you remember. So that was added on to the other infusion of the panitumumab. So anyway, the blood work showed that my magnesium is back where it should be. All of my blood work looked great, so no problems there. The other thing with blood is the CEA, the carcinoembryonic antigen number. It was 0.8. The last few times it's been 0.5 in response to the panitumumab and capecitabine treatment. So it's come up slightly, but she said that 0.5 to 0.8, she said, is basically within the margin of error, because actually a normal CEA for a non-smoking adult is 2 to 3.0 or under. So 0.8 is obviously, well within the range of a normal non-smoking adult. So that doesn't have cancer. So I'm happy with my CEA. The thing that we have to watch with that is just the trends. If it starts to spike, for example, before I started treatment back in February, my CEA had climbed to 3.7, which is still not that high, but the indication is just you're watching the trends. So for it to go from 0.5 up to 1 to 2 to 3 to 3.7, that means something is going on. And of course, that was confirmed at the time by what we saw on the CT scans with some those nodes, lesions in my liver that were getting bigger, and in my abdominal wall. As again, you guys that watch the videos, you know all of these details already. Okay, so my CT scans basically showed that my liver is totally and utterly clean as a whistle. That is thanks to the treatment, the chemo treatment that I had, and also the cleanup job that they did with the ablations just 6 weeks ago in July. They went in there and burned the ablations burned the lesion, what was left of the lesions in my liver, and they froze those little peanut, like pea-sized, we would say, not peanut, pea-sized abdominal nodes and nodules that were left over after the chemotherapy. So anyway, the CT scan confirmed that all of that stuff is gone. All the CT showed was they call it a cavity that's left from where the burning and the freezing took place. And there is no evidence of any recurrence or growth around the margins of those ablation sites. So of course, that's very good news. I was thrilled when that pelvic abdominal CT popped up on my results chart, which I saw before I met with my oncologist. Basically letting me know that now in my abdomen, pelvic region, that includes the abdominal cavity, my liver, there is nothing, there are no signs of cancer there. No disease. And that may be the first time that we don't even have a trace of anything showing up on a scan. Okay, then the chest, that's a separate, they do the chest CT also. Those results came in later in the afternoon. So I was, clicking refresh on my Mayo portal browser thing all afternoon. Finally, it came in. And nothing has really changed with that. I've mentioned before, for a very long time, my chest CT has showed very tiny spots, like on the order of 2 or 3 millimeters. One of those is now 4 millimeters, but that's still considered very tiny. The trends don't show that there's any aggressive development or growth. And my oncologist yesterday afternoon, she just said that when they're that small, chances are that most of them are benign. It could be scar tissue. It could be, everybody's got little spots in their liver, in their lung. And when they are that small, like on the order of just a few millimeters, they're not anything to worry about. And they're actually too small to biopsy. And it would not be necessary or beneficial to go on systemic therapy for something like that when we don't even know what it is. Those are things that just have to be watched. And if one of those little spots begins to grow more rapidly, or there's more of an aggressive look to it, that's when we start to get serious about it. But okay, you guys get the picture. The whole idea, blood work, great. Both of my CT scans, especially the one that shows the liver, indicates that I have very little cancer actively in my body right now. And of course, that's great news. I think I'm going to title this video something about, can stage 4 cancer be managed? Something to that effect, because I guess the issue is I come home and I'm excited and happy and grateful and thankful that I'm in the position that I'm in at this stage of the game, when it's almost 3 years since my diagnosis and a very grim prognosis. But I also know that stage 4 colon cancer nowadays, because of more effective treatments, it's being called more of a chronic condition. That means it's something that you just have to watch all the time, and probably most likely for the rest of my life. That means I get my get out of jail free card for the next 3 months, but then more labs, scans, oncology visits will be scheduled for the latter part of November. So maybe that means, most likely it means, I won't be having to go down to Rochester again until the end of November. And that'll be the longest period that I have not had to go for treatment or a procedure or an appointment this whole year, all the way back to January, when my CTs and blood work showed that the cancer was on the move a little bit and prompted me to get back on treatment. So, it's kind of a roller coaster. Yes, stage 4 cancer can be managed. Yes, everybody is different. Yes, we go through cycles of success and then recurrence and then treatment and then successful treatment and then maybe resistance to treatment. As you go through the months and the years, I guess if you continue to be a survivor, you are going to go through all kinds of different phases. And as you know, that's what I'm trying to get used to here. I'm going on 3 years. I've been through a heck of a lot. It was super hard that first year and a half. But my treatments the last year or year and a half have been successful. I have responded well. I have bounced back. And as far as recurrence, we all of you guys know people with cancer. Sometimes cancer is super aggressive. You don't even get a chance to knock it out. It gets you in 6 or 7 months. Other times you can deal with it either surgically or through some form of chemotherapy, and you might get rid of it for a year or 2 or 5 or 10 years. And then there's other people who are in between. I feel like that's me. Fortunately, I didn't get that 6 or 7 month or 1 year death sentence that people get. But also, I don't see myself as someone who's going to be with no evidence of disease or cancer-free for a few or several years. Maybe I'll be surprised and that'll happen to me, but I see myself as someone who is in that chronic condition situation where we're going to have to get scans every 3 months. Maybe at some point I'll get lucky and it'll be 6 months. But so far, I never go longer than 3 months without scans. So I'm trying to get in the mindset of that's what my life is. I'm grateful and thankful that I am being treated efficiently and competently and so far successfully. I can't tell you how grateful I am for that. But at the same time, I realize that I'm a person that is living with cancer. And that means that I never have to get to go for very many months without having to go through this whole thing again of the anxiety of, okay, is it under control or is it growing? Am I still responding to treatment, or has my cancer become resistant? Those are questions that nobody can answer. You just got to live it out, right? And that's what I'm trying to do right now. So, okay, 15 minutes, long enough. This is a good enough check-in, I think. And as always, I appreciate you guys being there, checking in, being interested enough to follow along. And I thank you for your prayers and all of your love. I get it from a lot of different directions all the time, and I'm so grateful and thankful. And I hope you have a great end of your summer and a great fall season, and I will check in again with you soon. Bye-bye.